Chronic pancreatitis is a long-term inflammation of the pancreas that progressively destroys the organ. Unlike acute pancreatitis, which is a sudden inflammation, chronic pancreatitis develops slowly over time, leading to permanent damage and scarring. This damage can impair the pancreas's ability to produce digestive enzymes and hormones, leading to a variety of complications. The most common cause of chronic pancreatitis is long-term alcohol abuse. However, other factors can also contribute to its development. These include genetic mutations, particularly in genes like PRSS1, SPINK1, and CFTR. Autoimmune conditions like autoimmune pancreatitis can also lead to chronic inflammation. Recurring episodes of acute pancreatitis, even without heavy alcohol consumption, can sometimes progress to chronic pancreatitis. In some cases, the cause of chronic pancreatitis remains unknown, and this is referred to as idiopathic chronic pancreatitis. Additionally, structural abnormalities of the pancreas or biliary tract, such as pancreatic duct strictures or gallstones, can play a role. The pathophysiology of chronic pancreatitis is complex and involves repeated injury to the pancreatic tissue. This ongoing inflammation leads to fibrosis, or scarring of the pancreas. As the pancreatic tissue is replaced by scar tissue, the organ's ability to function properly diminishes. Specifically, the acinar cells, which produce digestive enzymes, are progressively destroyed, leading to exocrine insufficiency, meaning the pancreas cannot produce enough enzymes to properly digest food. The islets of Langerhans, which produce hormones like insulin, can also be damaged, leading to endocrine insufficiency, resulting in diabetes. Furthermore, inflammation can cause pancreatic duct obstruction, leading to pain and further damage. These processes ultimately result in a pancreas that is both structurally damaged and functionally impaired. Chronic pancreatitis affects people worldwide, but its prevalence varies depending on the geographic region and population studied. It is more common in men than in women. Individuals with a history of heavy alcohol consumption are at significantly higher risk. The incidence of chronic pancreatitis is increasing, possibly due to improved diagnostic methods and a greater awareness of the condition. Genetic factors also play a role, so individuals with a family history of pancreatitis are at increased risk. The age of onset can vary, but it typically develops between the ages of 30 and 60. The signs and symptoms of chronic pancreatitis can vary in severity and may fluctuate over time. Abdominal pain is the most common symptom, often described as a persistent, gnawing, or burning pain that may radiate to the back. The pain can be triggered by eating, and some people may experience relief when leaning forward. Malabsorption is another common symptom due to the lack of digestive enzymes. This leads to steatorrhea, which is fatty, full-smelling stools, and weight loss, despite normal or even increased food intake. As the disease progresses and affects the islets of Langerhans, diabetes can develop, causing symptoms like increased thirst, frequent urination, and fatigue. Other possible symptoms include nausea, vomiting, jaundice, a yellowing of the skin and eyes, and, in rare cases, pancreatic pseudocysts, which are fluid-filled collections that can cause further complications. Diagnosing chronic pancreatitis involves a combination of clinical evaluation, imaging studies, and laboratory tests. A doctor will typically start by taking a detailed medical history and performing a physical examination. Imaging studies, such as CT scans, MRI scans, and endoscopic ultrasounds (US), can help visualize the pancreas and identify signs of inflammation, scarring, ductal abnormalities, and pseudocysts. Endoscopic retrograde cholangiopancreatography, IRCP, can also be used to visualize the pancreatic and bile ducts, but it's typically reserved for therapeutic interventions. Laboratory tests may include measuring levels of pancreatic enzymes in the blood and stool. Specifically, low fecal elastase levels indicate exocrine insufficiency. Blood glucose levels are checked to assess for diabetes. Genetic testing may be performed if a hereditary cause is suspected. Chronic pancreatitis can be classified based on different criteria, such as etiology or clinical presentation. One classification is based on the cause, dividing it into alcoholic, idiopathic, genetic, autoimmune, and obstructive chronic pancreatitis. Another classification looks at the stage of the disease, such as early moderate and advanced chronic pancreatitis. This classification helps to guide treatment and management strategies, tailoring them to the specific underlying cause and the severity of the condition. Treatment and management of chronic pancreatitis focus on pain relief, managing exocrine and endocrine insufficiency, and preventing complications. Pain management can involve a combination of approaches, including pain medications, nerve blocks, and in some cases, surgery. Pancreatic enzyme replacement therapy, PART, is crucial for addressing exocrine insufficiency. These enzymes are taken with meals to help digest food and reduce steatorrhea. For diabetes, insulin therapy may be required to control blood sugar levels. Dietary modifications are also important, including a low-fat diet and avoiding alcohol. In some cases, surgical interventions, such as pancreatic duct drainage or partial pancreatectomy, may be necessary to relieve pain or treat complications like pseudocysts or ductal strictures. Lifestyle modifications, like smoking cessation, are also crucial for managing chronic pancreatitis. Preventing chronic pancreatitis primarily involves avoiding or minimizing risk factors. The most important step is to abstain from or significantly reduce alcohol consumption. Smoking cessation is also crucial, as smoking can exacerbate pancreatic damage. Maintaining a healthy diet and lifestyle can also contribute to pancreatic health. For individuals with genetic predispositions to pancreatitis, genetic counseling may be beneficial to understand their risk and discuss preventive measures. Early diagnosis and treatment of acute pancreatitis can potentially prevent the progression to chronic pancreatitis. The prognosis of chronic pancreatitis varies depending on the severity of the disease, the underlying cause, and the individual's response to treatment. Chronic pancreatitis can significantly impact quality of life due to chronic pain, malabsorption, and diabetes. Over time, complications like pancreatic cancer can develop in a small percentage of patients. Recent research has focused on developing new pain management strategies, improving enzyme replacement therapies, and understanding the genetic factors that contribute to the disease. There is also ongoing research into regenerative therapies that could potentially repair damaged pancreatic tissue. Early diagnosis and consistent management are essential for improving the long-term outcome for individuals with chronic pancreatitis.